Next on Being Well, our topic of discussion will be kidney stones. What causes them, why do some people get them, and what is the treatment? Our guests include Dr. David Goldfarb, Chief of Nephrology at the New York VA Medical Center and Professor of Medicine at the NY School of Medicine. Also with us today is Dr. Stephen Daniel, Professor of Microbiology at Eastern Illinois University, whose area of research is gastrointestinal microbiology. We've got an informative program for you this week, so don't go away. Thanks for joining us for Being Well today. Gentlemen, thank you for coming to the studio. We should say that Dr. Goldfarb is here as part of a visiting scholar program that's sponsored by the College of Science and the Department of Biology, because you've come from a long ways. You're from New York.
That's right.
Well, welcome to Illinois.
Oh, thanks for having me.
Today we're talking about kidney stones, and Steve, you're going to talk a little bit later about some of the research. But Dr. Goldfarb, give us a little background. What are kidney stones and what causes them?
Well, kidney stones are most often made of calcium or uric acid. Those are the most common. There's a lot of other sorts. And they're basically minerals that are supposed to be dissolved in the urine, but sometimes there's too much of it in the urine. They precipitate and they form a little rock. And that rock is variable in size, and that stone can then obstruct the flow of urine, and that's when people become aware that they have a kidney stone and realize how painful it is.
Pain is a symptom, but how do you know if it's a kidney stone versus a gallstone or something else?
Once you've had a kidney stone, if it happens again, you're always going to know what it is, because the pain is pretty severe. You know, it's often said to be worse than childbirth. And women who have kidney stones and have babies think that the kidney stone's often worse than that. But it's a stabbing pain in the back. Usually would start in the back and then come around the side and then move down into the groin. As it progresses, as the kidney stone moves from the kidney down towards the bladder. There may often be blood in the urine, but not always. People are sometimes nauseated, have vomiting. It can be pretty severe.
Are there certain types of populations that get them more than others? Are men more susceptible than women?
Yeah, it's about men 2 to 1 women, but the rates of kidney stones are increasing both in men and women. More common in whites than in blacks, but again, both groups having increasing numbers. Young people, old people, it's really a disease that affects everybody.
Okay, and how do you get rid of them if you have them?
Well, you know, many of them are going to pass spontaneously. They'll just come out eventually, and that may take a day, it may take a week, sometimes a month, and it depends on if you're tolerating it and you're able to take some pain medications and go to work or go to school, then you may be able to pass it with time. But about 20% of stones are large enough that you'd need a urologist's help to get the stone out. And there are, you know, different treatments to get stones out if they're not coming out by themselves.
Okay, so when we talk about stones, we have a little vial of them here. How big is a big stone that causes a problem? I mean, these are little. Are these ones that are actually ones that were dissolved?
Yeah, those are stones that someone passed. And they're
very tiny.
They're small enough, I'll say this, they're small enough to have caused some pain and misery, but they're probably small, I should say they're large enough to cause some pain and suffering, but they're also small enough to pass spontaneously.
Okay. Let's talk about how they form let's get to the medical part of this, or the biology of it. How do they start forming? Because we have this model here that, you know, we're just dying to use. Tell us how they sort of form.
Well, they form in the body of the kidney.
Okay.
You know, and this part of the kidney is the collecting system. It's where the urine comes out of the kidney.
Tilt this up a little bit so you can see it on the camera. Okay.
And the kidney makes urine at the end, and the urine all comes into these different funnels. Those funnels are called calyces. And the calyces all come together and they're drained by the ureter. The ureter takes the urine from the kidney down to the bladder.
Okay.
And the stones usually form somewhere up here in the collecting system, and they get bigger and bigger. They're sort of like an apple on a tree. They get ripe one day and they fall off. Up until the time that they fall off, they don't cause any symptoms, and you wouldn't be aware that you had it up there. Then they get big, they fall off, and then they obstruct the flow of urine. Someplace in the ureter here, up at the top, or down near the bottom where the ureter enters the bladder.
So is that where the pain comes in when they get in this ureter?
Only when they get into the ureter, right? Because then the ureter is contracting. It's trying to push the urine out and push the stone out. And that's where the pain really comes.
It seems kind of like that's what people who have gallstones. It's the pain of trying to push that gallstone through. Is it kind of the same process?
Very much, yeah. When a gallstone gets stuck in the bile duct, draining the gallbladder into the bile duct, that's very painful, right? But you know, they're very different minerals. Gallstones are made out of cholesterol, while kidney stones are made out of most often calcium or uric acid.
Okay. Are there certain times of the year that people can get them more often than not?
Yeah, it's definitely a heat-related thing, and so while they occur all the time, they certainly seem to form more frequently in the summertime. You're losing more water through your skin, therefore your urine output is reduced, and your urine becomes more concentrated, and you're making kidney stones in the summer.
Okay, so generally, what percentage of them can be passed, and when do you really need to seek medical treatment, like from a urologist?
Well, about 80% of stones will pass, and people who have passed one before might think that they're better at it, at passing the next one. But about 20% of stones won't pass and will need a urologist's help. And 5 millimeters is the size that's usually the sort of the break-even point. A 5 millimeter stone, which is pretty small, is a stone that has a 50% chance of coming out by itself and a 50% chance of needing a urologist's intervention to make it move.
Okay. Are there any long-term side effects? I mean, can they ever be fatal? Do they cause permanent kidney damage if you keep getting them?
They can definitely cause repeated kidney damage as the result of obstruction. And so there is some concern about that. There have been so many advances in urology today that it's very unlikely to be fatal. You can certainly have an infection related to a kidney stone, and that's a different setting. That's really an emergency, because if you're not draining your kidney and it's obstructed with an infection, really that's a very serious condition. Then it needs to be drained immediately. But urology is so much better than it used to be. There's so many better techniques, flexible scopes to get into the kidney and remove stones, but this is not usually a fatal disease.
What are some of the ways that the urologist actually gets in there? I've heard can they take like a laser and blast it and break it apart, or what do they do? Right.
Well, one treatment's called extracorporeal, which just means outside the body, shock wave lithotripsy. It's like a spark plug. It generates a shock, and you can direct those shocks at the kidney stone, and the stone absorbs it and then breaks. That's done from outside the body. If you go into the body, then you can go up the ureter to the kidney stone with a scope. And that scope has a laser on it, and you can use the laser to break up the stone. For a very big stone, you might go through the back to get to the kidney. If you can't get from below, which is appropriate for smaller stones, you could go through the back with a laser and then destroy the stone that way.
So if you're at home, you're starting to have that pain, how do you know at which point you go, ooh, this is more than I need to get to the doctor? Is pretty severe this time? Yeah,
I mean, it sort of depends on if you've had the previous experience. You'd say, well, this time I have to go to the emergency room, or you could take some ibuprofen or another pain medication and relax and try to see if you will pass the stone. It sort of depends on whether you tolerate it or not. And lots of people can go a couple of days before going to the emergency room, and other people are going to be completely in agony immediately and will need to see a physician.
So when you say sort of relax, what do you mean by that? To let it, do you have some tips for people who know that they need to pass them? Is there anything to make it a little bit easier? Some advice you can offer?
I would usually take 2 or 3 ibuprofen. I would turn out the lights. I'd get into a warm bathtub and I would drink a beer. And that's a way of relaxing, and some of my patients tell me it works very well. But clearly, there are other times where you're going to go to the emergency room and need some serious pain medication.
Okay. So why do some people seem to get them and other people can go their whole life and never get them?
Well, there's a lot of factors that we're trying to understand. I mean, there's clearly an important genetic component, but we don't really understand what genes are responsible. So that's clearly part of this that we don't quite get. But many people with kidney stones have a family history and know very well that it's in the family.
That's what I was going to ask. If your mother has them, are you sort of, mother or father, chances are you might get them as well?
You definitely have a greater risk, that's right. There's no question that there's also some dietary issues.
Okay, let's talk about diet, because what should we be doing in terms of our diet to maybe prevent them or to lessen them if you are affected by them?
Right. Most of the recent data have suggested that being overweight is an important risk factor. People gaining weight is important, and so I'm always stressing, and this is of course related to diabetes and high blood pressure as well, weight loss is a good thing. Fewer calories is going to contribute. But then the carnivores are particularly at risk, the people who are eating you know, a lot of animal protein. And I'll emphasize here that I'm not talking about red meat, I'm talking about animal protein. So chicken and fish are the same. We're not talking about fat and cholesterol here and the risk of heart disease. We're talking about basically eating protein. And that chicken and fish are no different than red meat. So the more of that you eat, there's some evidence that will contribute to kidney stones. And the most recent data is also suggesting that less dairy is a risk factor for kidney stones. People used to think that eating more dairy, having more milk, yogurt, and the like would contribute to kidney stones. But the evidence recently is that those kinds of foods actually prevent kidney stones.
Okay. Well, Dr. Daniel, let's bring you into the conversation because you're doing some interesting research on why some people get them, why some people don't. And I know it has to do with bacteria, and I don't understand it. That's why you're here to kind of explain.
Well, we're still doing a lot of work on this, but there's evidence now that suggests that these are the bacteria that are found in about 30% of the population. So the idea is that if you're colonized with these bacteria, the name of them is oxalobacter, they eat oxalate. That's their only food that they like.
And oxalate is what causes the kidney stones.
About 80% of the kidney stones are caused by calcium oxalate, and so you can get oxalate from your diet. And this bacterium, which is in your large intestine, if it's there, if you're one of the lucky 30%, you will have these bacteria. They'll degrade the oxalate, and you'll have less absorbed from your diet. And so they've shown that you have a reduced risk of stones if you have these bacteria. Now, why are only 30% of the people in the country colonized, or the population? We really don't know. But one factor is possibly antibiotics and the overuse of antibiotics. These bacteria are very susceptible to many antibiotics that are used to treat a variety of infections and are often knocked out of or removed from the intestinal tract. And when you lose your oxalobacter, it's kind of difficult to get them back. You're colonized very early on in life when you're a child, and once you're colonized, they tend to stay there, but they can be knocked out, we would say, or removed by antibiotic treatment. So, and that's a bad thing.
So is your research trying to figure out how to get that bacteria back into someone's intestinal tract?
Part of the research is trying to understand how we can make this bacterium available as a probiotic. You know, right now there's a company working on this. The idea being that I don't have oxalobacter. How do I get it? Can I take it? Well, it's not available now, but they're trying to make it available and show that it really does reduce the amount of oxalate in the urine. If you can reduce the amount of oxalate in the urine, you have a less of a risk. And Dr. Goldfarb can, tell you about that, but less of a risk of forming stones.
So when you say probiotic, is it kind of? I mean, we see ads for yogurt that have probiotics. Is it kind of along the same line where there's that good bacteria in our stomach and our gut that sort of helps with digestion?
Yes, I mean, probiotic means the idea of a living organism. You're consuming a living organism. So when you eat yogurt, you're consuming lactic acid bacteria that are alive, and they're beneficial. They're good. I spend a lot of time in class trying to convince people that bacteria are actually good, not bad, and only a few are actually pathogens. And this is a beneficial bacterium, so you want these bacteria in your intestinal tract, in your large intestine. And the idea is, if they can get it approved, they'll make this available as a probiotic, and you'd actually consume the living organism.
Okay.
But right now it's not available, and there's a lot of interest in doing it.
How long has that research been going on, or how long have you been doing it?
Since the 80s.
Okay.
Forever, it seems like. So this is actually oxalobacter that I isolated. This is an electron micrograph of oxalobacter that was isolated from rats, from wild rats.
Okay.
And this is part of my dissertation work a long time ago. And these are crystals in the kidney of a rat that actually died. They died from kidney stones. I mean, they were so much renal damage that they died. So I've been doing a lot of work, and when I came here, I've been continuing that research with oxalobacter.
Dr. Goldfarb, are you involved in the research aspect, like what Steve's doing?
Yes, yeah. We've been doing related work, and that's where Dr. Daniel and I met at an oxalate meeting some time ago.
They actually have those?
Yeah.
Oh, yeah.
Oxalate.
Yeah. You would enjoy that, Lori. Our recent work, we showed that people with Helicobacter pylori, you know,
okay. What's that?
that's the bacteria that often causes peptic ulcer disease and gastritis. And so a lot of people have that, and they get antibiotics. And our study showed that people who had Oxalobacter, something protective against kidney stones, who got antibiotics for H. pylori, had their Oxalobacter eliminated. So suggesting that they would be at greater risk for kidney stones after receiving antibiotics for an unrelated process.
Okay. Are there other things other ailments that can come about because of kidney stones?
Well, you know, the big issue would be infection, something you'd want to prevent. And you asked about kidney damage. So certainly with multiple kidney stones and multiple procedures, especially if surgery is required for bigger stones, you certainly can lose kidney function. Some people don't find out that they have a kidney stone, don't have the symptoms, and may have a destruction of a kidney and may lose a kidney. It's unusual, but it certainly happens.
What about needing dialysis and things like that?
That would be very rare, but there are a few instances where I have taken care of people with really bad kidney stones, often related to having ulcerative colitis or inflammatory bowel disease, and they could wind up with enough kidney failure to require dialysis. It's unusual.
So what else is it that we need to know about kidney stones that I haven't asked?
Well, there are,
There's a lot to talk about.
Let's emphasize that the most important thing to do is to increase your fluid intake.
Okay, and what kind of fluids?
Well, almost any kind of fluid. I mean, I'll give you credit for drinking coffee, tea, some clear sodas are okay. Beer and alcohol don't hurt. So at the end of the day, you have to add up the total fluid that you had. And the goal is to drink a total of about 3 quarts. 3 liters, it's about 96 ounces. But I have to emphasize that people often say drink a lot, and people don't know what a lot is. So I want to be quantitative with my patients. There's a number, and you want to have more than 2 liters of urine every day.
Okay, so 3 quarts, it shouldn't be 3 quarts of soda.
Well, I'd say that there are other health consequences of that, you know, but if people want to drink soda, you know, then my emphasis is drinking the clear sodas rather than colas. Clear sodas have some citrate, and citrate helps prevent kidney stones. Vegetables and fruits like watermelon is an example. Oranges and lemons have citrate and helps prevent kidney stones. So if you drank clear sodas, 7-Up, Sprite, and that sort of thing, you're getting some citrate. I would prefer the diet sodas because there's evidence that fructose, of course, increases stone risks and are also associated with high blood pressure and the like. So.
But still probably good old-fashioned water. Steve, you think so?
Oh, yeah.
Mostly water.
Mostly water. Keep the urine volume up. And stay away from things like rhubarb pie and spinach, which are high in oxalate.
That's what I was going to say. There are foods that have high levels of oxalate. Can you kind of go through what those are?
Nuts, as I said, rhubarb, strawberries, soy. Some soy products have high amounts of oxalate. Let's see what else. You know, green leafy vegetables. Most,
so it's in some ways it's kind of the stuff that's good for us, like has
chocolate, yes.
Well, how do you know? You know, oxalate isn't really an ingredient. So how do you do some research to find out what foods are high in oxalate?
There are a variety of resources, but one is the Low Oxalate Cookbook. They actually have a cookbook out. I think through Mayo Clinic or through there is a foundation, Oxalosis and Hyperoxalary Foundation, that might have, but they have this cookbook for people who are interested in reducing the amount of dietary oxalate, and so they can cook low oxalate foods. And they do measurements and find out how much oxalate's in this.
So it is a naturally occurring thing in a lot of
and especially in plants.
Okay. And what you talked about protein, what is it about proteins that kind of lead to kidney stones?
Well, that's an important question. There's a couple of factors there. When you eat protein, you're really taking in more acid because you're getting, it's like sulfuric acid is in some of the amino acids when they're metabolized. So you wind up with more acid in the kidney, and that leads to changes in urine chemistry that's bad
Okay.
for kidney stones. And then the second thing, when you're eating muscle, you're eating DNA and RNA. That leads
Okay.
to more uric acid.
Okay.
And the uric acid in the kidney, in the urine, leads to more kidney stones.
Okay. You mentioned uric acid, and I'm not trying to pretend like I'm a doctor here, but because I've seen ads on TV, people with high levels of uric acid can also get the crystals that gout.
You can have gout. That's
so
right.
are those related at all, or?
Yeah, they're very.
Okay.
Yeah, they are very closely related. In fact, people with gout have more kidney stones,
Okay.
and some of those stones may be uric acid, and some of them may be actually made of calcium. But people with gout are at risk, and we are testing. You've seen that the advertisements on TV. I've been working to see whether patients treated with drugs to lower the amount of uric acid in the blood and urine will prevent kidney stones.
So, Steve, you talked about your research. I mean, how far away are we from being able to have these probiotics put in regular food or something that you can get? Is it years, or where are we at?
Well, I would say it's still a little ways off, but I think it's close. If they can get, they're doing right now some clinical testing. They're trying to show that by consuming oxalobacter, your plasma level of oxalate and your urinary oxalate go down. But they're doing it with a certain population, and Dr. Goldfarb can address that. It's kind of a demanding clinical study, but it may be that the probiotic would be better in another population of people who are suffering from kidney stones. And there are different groups. Some people form a lot of endogenous oxalate in the body, and that's called primary hyperoxaluria. And they've been testing those individuals with this probiotic, and they've seen sort of mixed results. But it's safe. They've shown the safety, that this product is entirely safe to consume. It's just they're having some difficulty showing that it's effective in all cases.
Is that the primary research that's going on to help with kidney stones or prevention of them? Or are there other studies going on, or is this kind
Well, Dr. Goldfarb's got some work going on. We mainly deal more with culturing, and we do some fecal collection and detection, who's colonized, who's not. But he's actually, does a lot more clinical studies.
Well, tell us a little bit about some of the things that you're doing.
Well, there are also, as we talked about, there are drugs, and exactly when those drugs are best to use is a question. Some drugs lower the amount of calcium in the urine. And that's important because the other part of the disease that we haven't talked about, and you ask about other consequences, people with too much calcium in the urine are at risk for having lower bone density as well. So people with calcium kidney stones are at risk for having more fractures, and it can actually have osteoporosis as a result. So the possibility of using drugs that reduce the amount of calcium in the urine that will also lead to increased bone density, that's beneficial.
So right now, is there any type of prescription medication out there for kidney stones?
Yeah, the major drugs are thiazides. Thiazides are commonly used for the treatment of high blood pressure, but they have this nice other effect. They lower the amount of calcium in the urine, and that calcium winds up in the bone. And then the second treatment, I talked about citrate a little bit. Potassium citrate is a common supplement that we give to people. More citrate in the urine means that more calcium will remain dissolved. So potassium citrate is a common prescription. It's difficult to get enough of it over the counter without a prescription, but certainly, as I said, eating more fruits and vegetables that are low in oxalate will increase the amount of citrate in the urine and help prevent kidney stones.
Okay. We've got about 3 minutes left. I kind of want to wrap up with, okay, someone sitting there saying, I suffer from kidney stones. What should people be talking to their doctor about, and so that they can get the best treatment possible, or things that they should do to try and prevent these? It's hard to prevent them, but to make them maybe a little less common.
Well, I'm a stone former myself, and so this is a club that I feel very strongly about being a member of. I think the major thing is that many physicians are just not recognizing that kidney stones are preventable, and I think patients have to say, what do I have to do to prevent this? And I think the first thing is to increase fluid intake and really be a little scientific about it. 3 liters, 3 quarts, that's the amount you want to increase your fluid intake to. Everybody can't do that. Some people just don't tolerate it. And in that case, it may be that there are dietary changes. And if you recognize that those diet issues are also related to a risk of diabetes and high blood pressure, it helps motivate you. This isn't just an inconvenient problem. It's linked to other parts of your health. So changing your diet is important. And then there are medications that are appropriate, particularly if you've looked at the urine and done a 24-hour urine collection and said, this person has a lot of oxalate, let's change the diet this way. Or this person has a lot of salt, and that leads to a lot of calcium in the urine, let's change the diet this way. I want to be specific about what people's risks are. Rather than saying, here's all the things you can't eat, I'd like to say, that's what your urine shows, and that's what we should address.
And is that generally what physicians do for patients? Do they do a urine test to sort of see what's going on, what you've got too much of, not enough of? Is that a typical test?
I think it should be a more typical test. I think very often physicians are not really aware that that's one of the possibilities or how to interpret the results. So we certainly want to promote the idea that more patients need to be aware of what their specific urine risk factors are and how to address that.
Because that really tells a much more complete story of what's kind of going on in the body.
That's exactly right.
Steve, what advice do you have? Thoughts?
Well, as a gut microbiologist, I would say you know, these types of bacteria are very beneficial. They're not always going to be the magic bullet that cures everything, but because forming stones is, you know, is complex, and it probably involves, well, it doesn't probably, it does involve a lot of factors. But I would say, you know, don't practice, you know, good use of antibiotics. Don't demand them for every little thing, especially for a viral infection, because, you know, you take these and they may eliminate the bad bacteria, but they're also going to eliminate these very,
and we've heard that over many times.
But
We've talked about it a lot in this show.
Yeah, and exactly. And in this case, you're eliminating good bacteria. So I would, that's one of the main things I would say. And, you know, eventually this will, I think, will be out as a probiotic that you'll be able to take.
All right, well, it sounds like there's some hope on the horizon I've personally not suffered with them, so I feel your pain.
Thank you.
Thank you, gentlemen, for being on this show and providing us with great information on kidney stones. We appreciate it.
Thanks for having us.
Yes, thanks.